So folks are being admitted from the waiting room, so just bear with us as we let folks in, and then as folks continue to come in from the waiting room. But we are ready to get our program started here over the next hour. And I will reintroduce myself in a minute here, but my name is Pam Lowe. I'm the Senior Director of Development here at the School of Nursing. And hope everyone is having a great day today. And I'm going to look to my colleagues, Talise, who she has been admitting folks. And Talise, does it look like we have anybody else at this point who's waiting to get in, or have pretty much folks who are waiting, they're in?
We've admitted everybody, and anyone else who joins will just add them in.
That sounds great. Okay, well, we've got a full agenda today to go through with a robust presentation from several of our faculty members. So first, though, I'm going to buzz through a few housekeeping items. And one, again, my name is Pam Lowe. I'm the Senior Director of Development here at the VCU School of Nursing. And we host these virtual events periodically throughout the year with different topics in mind, knowing there's different things going on within our school that you may be interested in tuning into. So I'm grateful for those of you who are interested in tuning in today. All right, so today we are going to be doing a deep dive into work done by a team of our faculty, and I'm going to introduce them. Feel free to wave, and they are also should be pinned as across your screen as well. But folks who are presenting today include Dr. Dana Burns, Dr. Carla Nye, Professor Allison Gregory. They are all clinical assistant professors in our Department of Family and Community Health Nursing. And we have Dr. Leanne Breckenridge, who is a clinical professor. So today, these four faculty members will provide information on their work to improve clinical placements for family nurse practitioner students using their Dyad model. So we will hear about their work on this project, including its purpose, accomplishments, obstacles, and the next steps. And before we get started, I just want to go over a handful of housekeeping items. We are recording today's event. There were several folks who were unable to join us. So just an FYI regarding that. You're only going to appear in the recording if you are speaking. So just so you're aware of that. And we're going to let our faculty move through their presentation first. However, if you have any questions that come up, feel free you can either private message them to myself or in the general chat box. Also, I welcome any of you who want to use the chat box to say hello, introduce yourself and your affiliation with the School of Nursing. We always appreciate knowing who is on the call today, and just to keep yourself muted. We also appreciate that too. And just a couple of introductions before I hand things over to our faculty. I'd like to introduce my team first. We have Laura Keller. She's our Alumni Engagement Coordinator. She's given you a wave. She works on connecting and engaging nursing alumni to our school. We have Catherine Stein. Hey, Catherine, she's our Scholarship and Stewardship Specialist, handling our scholarship process and coordinating with scholarship recipients and stewardship initiatives. And Talise Owens, who you would have communicated with for today's event. She's our Development Specialist in charge of donor acknowledgements, and she also assists with event planning and coordinates events like today with our virtual events. And we have our Dean here today. So we have our Dean, Jean Giddens, and want to acknowledge her. And also, Jean, you're going to be tuning in for the whole hour, but if you'd like to unmute yourself to say a quick hello, that would be great.
Well, hello, everyone. Good to have you join us. I think you're going to be delighted to hear about this really fantastic work done by our faculty around this project. And just want to say how important it is to have the support of many of you who have provided funding to our clinical scholars program. And this is a great way to understand how important this work is and the benefit that we have from your support. So thanks for joining.
All right. Thanks, Dean. And from here, I'm going to hand things over to our 4 faculty members who I briefly mentioned their names. I'm going to let them take things over from here to move through our presentation.
Good afternoon, everyone. My name is Dr. Breckenridge. You can call me Leanne. I am delighted to be here and delighted to get us started. We have done a feasibility of the Dyad Preceptor Model, which is one of our clinical scholars projects. And on behalf of the team, I cannot thank you enough for the funding to do this, but also the opportunity. It's just been really fun. Go to the first slide. So where did all this begin? For those of you that are nurse practitioners and or work in academia, you will know that we would all sit around right before time to put everybody in placement and go, we can't find enough preceptors. So that's an issue all over the country. And so we had to be innovative and say, what can we do? Well, thanks to Dr. Burns, she had this great idea, and so that's where you'll see our jumping off point. But let's first talk about the problem. And so when we look at the preceptor, you can see that they have, all these nurse practitioners have increased patient loads, and not necessarily nurse practitioners. We also use physicians, we use PAs, as well as nurse practitioners. So, you know, these medical facilities are saying we need for you to see more, and so that oftentimes makes it challenging. Preceptors often work in silos. They aren't able to reach out to other preceptors, which is also can be a problem. They sometimes don't know how to actually precept. They've never precepted before, and so they won't precept because they don't feel like they have the knowledge to do so, or they precept so much that they are burnt out. And then some external things that we need that, you know, brought our attention to all of this is that COVID-19 happened, and it really made things challenging. Clinics shut down, we were doing telemedicine, and everything was very different. And so what do we do with all these nurse practitioner students who needed to get their hours in? Also, regulatory requirements change periodically. And so we might have gone from 500 hours that were that our students need to do to now 1,000 hours or 750 hours. So over the years, things have changed. And then, of course, also the business culture. Many times we think about the almighty dollar, and that can sometimes get in the way. It is a very important part of making our clinics run well, but that sometimes can prohibit students from coming in because they think it might slow down the preceptor, etc. And then we have to think about our programs. We are always wanting to increase enrollment. We want to make our programs the best, and we want to you know, include more programs if we can. And then the other thing that we have to think about is that many students now, and if you go on indeed.com, they're always looking for preceptors, paid positions. So these students are going out and paying preceptors $2,000 a semester just to precept them. And so we are competing with some of that as well. So some of the preceptors won't precept unless we're paying them. Thankfully in Virginia, we now have something that helps with that, but not everybody knows about that, that preceptors can get paid. All right, so those are the factors impacting lack of preceptors. So then we look at our model. Currently, traditionally, we have one student, one preceptor. The faculty will go and visit the student and the preceptor at one site. And so as you can see, then we have the second rotation 2. So for our particular situation, the students start in the summer, which will be rotation 1. So then we have a preceptor there, then they come to the fall and we have another preceptor, usually a very different preceptor because we want them to get a variety of experience. And then in the spring, they'll go to yet another place. So you can see we need 3 different preceptors for 1 student. And so as you will see, the way we are doing things that what this project did is kind of change that a little bit. So.
Thanks, Leanne. This is Allison Gregory, and I'm going to pick up here. You heard Dr. Breckenridge talk about that traditional model where you saw that image, the preceptor and students were kind of siloed. So keep that in mind as we talk in what we did with this project. So the overall purpose of the project was to explore the feasibility of using a dyad clinical model to precept students, with the ultimate goal of meeting the need for preceptors for NP education. So what is a dyad? So it's 2 students working together as 1 unit, in contrast to that 1-to-1 model where there's 1 student, 1 preceptor. The unique thing is that the students work together as a unit to provide care to patients. So we wanted to know if this would be feasible in our environment, in the local area, and with our students. Previous studies had shown that it had been looked at in other education and pre-licensure programs, and particularly certified nurse midwife programs. But we wanted to know if this would be something that we could do. Dr. Burns had been trying this out a little bit in her clinical practice, but we wanted to expand it and see if we could look at how feasible it would be in our FNP track. So our project had 2 overall aims. Aim 1 was to assess the perceived willingness, knowledge, and self-efficacy of the preceptors and supportiveness of the sites. So those sites like the clinical unit, facility, the administration and other staff, team members, how supportive the environment was for the use of the dyad. For that aim, we used 2 tools to measure. DMPA, it's the Dyad Model Preceptor Assessment. That's a tool that we developed as a team to get at that willingness, knowledge, and the supportiveness of the site. And using a dyad, so 2 students working together with 1 preceptor. Aim 2 was to look at the potential barriers and facilitators to the dyad model from both the preceptors and the students' perspectives. So we assessed that aim by focus groups. 1 focus group was looked at the preceptors, and another one looked at the students. One of the things that the Clinical Scholars Program helped us with was to be able to have a research assistant to help facilitate and transcribe those focus groups. So with the project structure, let's look at the structure a little bit. That's what this slide is showing you. For some background, just so you understand, this is a clinical group. So our practicum courses have different sections, and each section has up to 8 students. So we had 1 clinical group in the project. And you see those red boxes on the slide. Those represent the dyad, the pair of students, and the preceptor. And the pinkish arrow there that connects those, that represents the fact that the students would rotate around different clinical sites to get a well-rounded experience. That's what we call the pod, and we'll talk about that in a little bit. Next, look at those blue boxes, the preceptor team meetings. Those represent periodic meetings with our preceptors, and those had several aims to them. One of the biggest parts of those team meetings was an opportunity to help work with those preceptors that were precepting a dyad to develop their precepting skills. And at those team meetings, each one had sort of a theme to it. The first one was to work on providing feedback and developing goals. We'd take some of the information that we gathered from that team meeting and help us plan for the next one. The next one was about managing challenging situations with students. And then the last one was about evaluations. So helping those preceptors learn to evaluate students and developing those skills. In the center of this slide, you see that master clinician faculty. That's the faculty, that's the clinical faculty for that group of students. You see the site visits, so there's constant communication between the preceptors, students, and that faculty member. And that faculty is the person who's coordinating those experiences and serves as support for both the preceptors and the students. One of the other, from those team meetings, we also gathered information to help us plan for that focus group session that was at the end of the project. And one of the consistent themes across all of those meetings was managing the student personalities in these dyads. So the students learning not only to work, to learn what they need to know as an NP, but also learning to work together as a team.
And hi, I'm Carla Nye, and I'm going to be providing some information about the quantitative data that we collected. Because we had small numbers in this group, we used one clinical group and one group of preceptors. It's just going to be descriptive statistics. We were not able to do, obviously, with such small numbers, any particular type of quantitative analysis. But we can give you a little bit of information about the people who are participating in our study. So first I have students, which is an N of 5. There was actually 6, but one student did not complete the demographic data for us. These students were all FNP students. They were all in their last semester of their practicum, so getting ready to graduate. And they had anywhere from 3 to 15 years of work, and you can see their primary work setting. We had 5 preceptors. All preceptors were working in an academic medical center. And so they all worked for the same academic medical center, but didn't actually work. They were not co-workers in the same clinic. They had an average of experience from 5 to 10 years working as an NP, and they had some experience with precepting. 4 of our preceptors were experienced in precepting. One of our inclusion criteria to be a preceptor is you had to have at least a semester of precepting a NP student in the past. And so we had one preceptor who was new, who'd met that criteria, but the other 4 had precepted fairly frequently for us in the past. In terms of experience with student dyads, 3 of the 5 had. Not all of them was nurse practitioner and nurse practitioner. Some had a dyad of a PA and a physician or a medical student. Some had a medical student in an NP. So there was a mix of background and experience there. And now to talk about our first tool that Allison had talked about before, which was the Dyad Model Preceptor Assessment. Again, this tool was developed by the team. We used resources on tools that were similar to this, but weren't necessarily focused on preceptors, but we're trying to get to the same data. And we use those as a model. And then we did send the tool out to preceptors who were not included in our actual study to look at it from a content validity standpoint. Were we hitting some of these? Did these questions make sense, and were we hitting the topics we wanted to hit? So when you're looking at the Dyad Model Preceptor Assessment, which is the main piece on the left with the 7 questions, what I want you to think about is, in our case, this was a 1 to 5 Likert scale that we used in terms of their comfort, but the smaller number is better. So 1 was the most, the highest level, like I absolutely agree with this, and then the larger number was I disagree. So when you're looking at this, the question up at the top, the pre and post data remained the same, it didn't change. But when you look at the other 6 questions, there was improvements all the way across. And again, we don't have any statistical analysis on this, but it was nice to see that there was a trend towards more comfort and more willingness to have dyad students in their areas. And the 8th question had to do with barrier to dyads, and then they got to do a check mark. Yes, this is a barrier. No, this is not a barrier. And you can see from this, from pre to post, 5 of the questions, they became less of a barrier after they've had the experience. They kind of understood, they went from kind of thinking what it might be like to actually experiencing what it was like. And most of those barriers went down. They were much lower barriers than prior to starting. The only 2 that didn't change was patient scheduling and productivity. And that productivity and patient scheduling was a big topic we talked about quite a bit during those the preceptor support sessions. It gave them an opportunity to communicate about some of these barriers, and they talked a lot about how one person might solve it in their area and how another person, oh, that's a great idea. I want to do that. That's wonderful. The one thing to think about with this, we started this project in January of 2022. Wow. January of 2022, which was 1 month after they instituted a new EHR into this particular academic health system. So their concerns about productivity, time constraints, EMR access at the beginning were much higher because they had a whole new system they were dealing with. So to see those go down was really satisfying to see that those numbers were less. All right, the last quantitative data that we have, we did the general self-efficacy scale, trying to get an idea about, did our support, did it make a difference with this very, very well-used, strong psychometric self-efficacy scale. And as you can see from the little slide to the right there, we didn't make a difference. They were exactly the same. So you'll hear more in the focus group, which Dana is about ready to speak about what the outcomes were from that. But so even though we didn't see any changes with our N of 6, I think you're going to hear how this actually really did make a difference. And it came out really clearly in the qualitative work that Dana is going to talk about next.
Oh, you're muted, Dana.
Doing the slides and talking is always challenging. So as you'll see, it's always a good idea when you're investigating a complex topic to do both qualitative and quantitative data analysis and investigation to get a full picture of the results and the impact that you can have. So this slide has a lot of data on it. So I want to talk about it first, in that our group used this opportunity to drive and investigate and learn qualitative data research models and modalities. This was a great learning experience. What we dove into was the use of focus groups to investigate a complex phenomenon. Prior to project launch, we consulted a qualitative research expert, our own Dr. Patricia Kinzer, because of the complexity of this investigation. The grant provided us funds to hire and train a graduate nurse, a graduate assistant to help in the process. So this qualitative data was gathered via focus groups. Our team created the focus group prompts based on themes from student issues that arose over the semester, as well as issues that arose during the preceptor support sessions. Nayab, our graduate student, she led the focus groups. These focus groups were videoed and audio recorded. Then those sessions were transcribed. Importantly, they were de-identified to help reduce any bias during the data analysis phase. When we were prescribed or given the transcripts, we analyzed them using both 2 different qualitative data frameworks. There's one by Duty and one by Sandalowski. That sort of gives us the steps and the procedural process to properly identify themes and help those qualitative concepts and ideas come to the surface. So one thing that we need to highlight is that all our NP students completed their clinical hour requirements. All of them earned a passing grade, which was based upon course assignments and successful preceptor evaluation results. So what I want to dive into is we'll start with the student perspective, or the student perspectives. Initially, the students really felt that the dyad, 2 students working together as a unit, was positively impactful in reducing stress and reducing overall anxiety, which they felt helped them learn easier. They liked the ability to have a safe person to bounce ideas off of, as well as discuss issues and concerns while they were in clinical in that learning process. Students reported that they initially, also as they progressed through, they went back to the dyad when they had a clinical complex case, meaning they worked distinctly together. An interesting theme that came out though, as students became more confident and they became more familiar and became more comfortable with those knowledge, skills, and attitudes, they went into pairs, meaning they were at the same clinical site with the same clinical preceptor, but they worked a little bit more on their own. And then as they progressed to the end of their clinical rotation, they were then working, they split even more to be more independent. So there was a progression, dyad, pair, and then independent. Going to the other side of the slide, one thing that we noticed, I'll talk it through, is that the preceptor themes, the preceptors felt that they working with the student dyads were very doable. The clinic and the support staffs especially adapted to that dyad precepting model. They were able to manage 2 students, they were able to see patients, and they were still able to provide high quality clinical education. Preceptors reported they significantly felt more engaged and empowered with their preceptor role because of the preceptor support sessions. They learned from faculty and they learned from their fellow preceptors that they were able to navigate complex situations as well as improve their precepting skills. The biggest thing though is that camaraderie and that sense of community with faculty, with the students, and with their fellow colleagues, that they were a team. They weren't alone. And so some of the students really enjoyed it and some had some mixed reviews, but what came out was there is a dynamic progression of students learning and how they progress through clinical, as well as a dynamic learning from the preceptors, meaning everyone is growing, everyone is learning. When there is a team setting, they learn in a less anxiety-provoking setting, so they learn well. Some issues that came up, you're looking at, I'm focusing on the middle slide. Some key barriers that were presented was, it was a little challenging to manage the personalities of 2 students at once. Building those relationships can be complex. Some facilitators of the dyad model was that the experience of witnessing these students grow over time, and this is a little bit more towards the pod model that we'll explain it after. But this over time and working together and teaming really was a powerful impact of creating community. And the role of that School of Nursing faculty to help reflect and learn through the process and having that support was key. But it's the coming together that is really important. I'm gonna go to the next slide. And so one thing that we wanted to sort of prompt for discussion to give questions, because it is a complex issue, is it feasible to precept students using the dyad model? The overall theme is yes, it is doable and it is functional and it has positive outcomes. One thing that we've seen is that you need motivated preceptors that are willing to try something new, that want to learn, and that aren't afraid to engage in something innovative. You need to have highly engaged faculty that want to go out, schedule the meetings, still visit the site as traditional model, but provide that extra support to the preceptors. That again, that preceptor education and support is really key. The big thing though is that it's in a team setting with multiple preceptors that can come together. It is feasible with a single clinical group. The number of students is important. 6 to 8 students appears in our preliminary work to be optimal. And in our setting with this project, all the preceptors were in the same academic health system, and all the students were from the same university. So it was a pairing of 2 systems that came together. I'd like to then highlight the next steps that this project then has led us to the next step, because we already have positive outcomes. This is the next step to this expand on the dyad is the Dyad Pod Model, because we do quick PDSA or plan, do, study, act cycles. Our new model is looking at taking 2 students and having 1 preceptor, again, the dyad, working in set rotations over a semester, which is from the original model where they go for 1 month with 1 preceptor. We have a student meeting, we have a preceptor meeting, and they go to a new rotation for 1 month, a new preceptor and the same dyad students. You have a student and preceptor meetings, and then they go to a 3rd rotation, and they have another meeting over 1 semester. Now our model will be over 3 semesters. And so what we're hoping is that this longitudinal competency-based clinical learning experience really capitalizes on the concepts of empowerment in clinical teaching, really evokes that psychological safety and that concept of teaming, all of us coming together to help students learn from going a novice to not quite expert, safe, competent, and transition practice ready nurse practitioner. So if anyone has any questions, we allowed ample time to discuss our topic.
All right, well, Dana and team, thanks so much for sharing about this particular project. We really, really appreciate it. And what I wanted to do before we move into questions was to share also with this group is that, how is this particular project funded within the School of Nursing? It's funded through what's called our Clinical Scholars Program Fund. And this particular fund was established some years ago by initially kind of a core group of supporters who wanted to ensure that our clinical faculty had opportunities to develop their scholarship and their research. And so I just wanted to make sure that you all on the call today were aware of that. And in fact, I'm pretty sure I saw Judy Collins join us as we got underway here. She was a member of that core group among a few others. And so a special shout out to Judy. So from here, we have some folks who had submitted some questions ahead of time. So what I would like to do is share those questions first. And then after that, open up the floor for folks who have additional questions. Okay. And again, you'll have time to either unmute yourself or share any questions in the chat. But first, so our first question has to do with what has been the most meaningful aspect of being a clinical scholar. And I'm going to hand that over to Dana. I think you are maybe going to take the initial lead, but then pass that over to any of your teammates there.
Oh, well, thank you. So the clinical scholar is an opportunity for our non-tenure or doctorally prepared or faculty that would like to investigate a teaching or clinical problem. And what has it done for me and how has it impacted? It's given me a place to expand my wings. We see problems all the time in our various environments. The clinical scholars was an avenue for me to present this problem and have the support of seasoned researchers, a research department, to have funds to enable a project to go forward, and getting together with people who could really help me through those steps. It's a daunting task when you're a practicing clinician and at academic teaching classes to focus on your research or your area of scholarship. And the clinical scholars really opened that door and providing the structure and the space that set us up for success. It was really helpful. Pass it on to another colleague. Who would like to jump in? Carla, Allison, Leanne?
I can jump in next. So interestingly enough, this is the second clinical scholars project that I have received, and I am now also a donor as well as a recipient. So, because of everything that Dana just said, I feel really strongly about building and mentoring our young faculty as we're going through, people who haven't had experience. Because what I have found from the first Clinical Scholars Project is it really provided a springboard of experience. Dana said it opened her wings. That's exactly it. You've got a huge amount of support from the School of Nursing, from the School of Nursing Research Office, but it does provide you with a safe space to learn. And from that first project, it's just expanded exponentially. You get confidence and you start to believe that you actually can do this. And my hope and dream as a donor is to continue to really support the junior faculty who just don't even know. It seems too big and it seems too scary. And that's what this Clinical Scholars has been really helpful for, is to make people, give them that environment where they can learn and say, oh my gosh, I actually can do this. I have the skills and abilities. So thank you.
I want to jump in because Carla didn't mention it. And there's an important story to Carla's situation. And that, yes, she had a clinical scholars opportunity early. And since that time, she's gone on to write a major federal grant and be the recipient of a large federal grant. And I dare say that would not have happened without having some of those early experiences provided for by the clinical scholars funding. So these are the long-term stories that we sometimes forget to tell. How these experiences are so important to the ongoing career trajectory of our faculty. So
Thank you.
congratulations, Carla.
Thank you.
I agree. Now let's see. I don't know if Leanne, if Allison, if you had anything that you wanted to add regarding your experience, or.
So just that, to reiterate what Dana and Carla said, that it's a good way to sort of explore a problem that you're interested in, and that maybe is to get your feet wet in a way to start to learn how to address it.
And Leanne?
Yeah, so I agree with everything everybody has said. It is actually made me want to do more, which is the whole idea, right? So, but here's the other thing is, now I've started my own dyad and I love it. And I feel very lonely when I don't have two students with me all the time. So in the clinic setting. So I've learned from this project, but also the whole writing the grant and doing the actual study, and it was just a lot of fun. So I appreciate it.
What? Oh, and Dana, you've got a comment question.
One other just comment in that the partnerships and the exponential growth that you can experience from doing that first step. So our Dyad model was embraced with our preceptors. Our preceptors are in an academic health system really close to here across the street. But Leanne now has started a Dyad pod in the community. But a really exciting thing is that the pod model now has been requested to be a model for precepting the transition to practice nurse practitioners and APPs in the acute setting from the health system. And so it's very exciting. We're investigating ways that we can adapt and grow this model for more impact and expanding it upon, because we could prove we had positive outcomes. It was really great. So thank you.
Well, great. Well, I appreciate each of you sharing your different perspectives. It's super helpful. And I think it's really helpful for those folks on the call, like I said earlier, just to really be able to understand how just various donations have been put to work in a really big way. Now, that first question, that was, and I'll just go ahead and put it out there, that was submitted by Judy Collins, and Judy private messaged me and said that while we can't see her today, Joe, her husband, is also on. And so they are a powerhouse pair. And so, so Judy and Joe, again, thanks so much for your leadership, among others who aren't on the call today, who weren't able to join us, but just for you both to really just put this program together several years ago. Okay, we have a couple of other pre-submitted questions, and one of those questions is, how do you vet mentors and preceptors?
I can talk to vet how the school, particularly in the FNP track, vets preceptors. And I always see those as, in addition to faculty, they're the first mentors for many of our new NPs. So we vet preceptors in general many ways. It usually starts by some of the basics, most straightforward things, or just the things we have to do for accreditation, like, the numbers of years in practice and licensure and things like that, to make sure that they're an appropriate person to be precepting. Then we look at the facility. Most of the time, preceptors come from facilities that we know well, right? Some of the larger health systems or group practices in the area. If we don't know the facility, then that usually triggers a insight visits, to even before we send a student there, just so we can get to know the site and understand what kind of experience a student would have there. Other than that, if it's a new preceptor but a well-known facility to us, we might start with a phone call and just talk through the practice, what kind of experience the student might have there, the experience that the clinician might have as a preceptor. And then we go into more routine evaluations of sites and preceptors that are just part of our day-to-day quality assurance for the program. So hopefully that answered the question from the attendee who asked it.
Yeah, I appreciate that, Allison. And we have a couple of other, Caroline, you've unmuted.
Oh, I was actually going to ask Dana because Allison gave just a great picture of a lot of the work it takes to get a preceptor and to even get to the starting point. But Dana, did you do arm twisting? Did you offer, like, because you were able to develop a cohort of preceptors that were really engaged. Is there anything else on this specific group that you can speak to?
I sought out preceptors that were very motivated, that had positive student evaluations, and that were willing to try something new. So it's their ability to step out of the box a little bit. And it wasn't arm twisting. It was definitely, we have this great idea and you're already doing some of it, but would you be willing to try it a little bit more, and we'll be there for you and provide support along the way. It's really coming together and helping people not be by themselves. I think it's creating that community that is what people are craving.
All right, well, thanks. And thanks for the added perspective, Dana. All right, a couple more questions. How do you see the role of the nurse practitioner expanding over the next 10 to 15 years?
I'd say I can jump in and start on that one. The actual role, scope of practice is governed by laws and all of those pieces. But we have seen, I feel like I've written this so many times in different papers, but there is a drastic shortage of primary care providers that is only going to increase in our country over the course of the next 20 years. The American Academy of Medicine has details out about the numbers, and we're talking 20, 30, 40,000. It's really hard to increase the size of medical school programs, or at least in our country it is. And we are highly trained, highly capable, and a profession that can help to fill that need for taking care of the healthcare in the United States. So it is it's going to grow in terms of the numbers of nurse practitioners that we're going to need. And it's one of the reasons why we're looking for ways to try to expand the number of students that we can manage in the program, because you want to be able to try to provide a phenomenal educational experience where you really are sending out students that are graduates who are able to move into the role with just a good, orientation. But the numbers of nurse practitioners are going to go up, PAs as well, because we have not figured out because we're good and our outcomes are great. I don't know if we've talked about that. We haven't talked about outcomes, but Dana's got her hand raised. She can do some outcomes discussion.
Well, it's been shown that nurse practitioners can provide excellent, safe, high quality care and meet that patient need, as well as improve outcomes, and especially in complex disease and long-term care management. Nurse practitioners have equal or improved treatment outcomes and patient outcomes. There's also been data that shows that nurse practitioners do a similar or a more amazing job cultivating, again, those relationships that empower people to take care of themselves. So nurse practitioners have the time, the skill, and the knowledge to provide great care. And we need to be able to increase capacity to meet that need. And so one limiting factor is clinical education. And so expanding that will help to meet that need overall in the next 10 to 15 years.
Terrific. Allison, Leanne, anything else to add? Nope. Okay. All right. One final question, which I'd appreciate our Dean speaking to, and that is how will the recent overturning of Roe v. Wade impact the role of the nurse in general and nurse practitioners specifically? And Jean, I'm not sure if you have anything that you could add to that or speak to that, or Dana, I see you've also.
I can chime in. I think as healthcare providers, we are going to provide the best care we can. We meet our patients where they are, and we provide the care that they need. And there are always going to be changing dynamics, laws, regulations, political environments in different communities, and that's okay because that's real life. But meeting our patients where they are and providing the care and the comfort and the healing that they need is really our primary objective.
All right. Dana, I appreciate your response on that. So those were the pre-submitted questions, and I'd like to see now if anybody would like to unmute themselves or ask a question in the chat, or perhaps if Talise or if any of my teammates, if anyone shared a private message with any of you. I see Talise. No, not on your end. All right. I say going.
While people are thinking about their questions, I'll just make a comment on how proud I am of our faculty and this kind of work and the evolution of what's happened in our school with the type of scholarship that is not only done but valued. And Carla's been on this journey with me for sure. When I came here, it's been 9 full years now, if you can believe that. There was a fairly narrow definition of scholarship, and it was the big R type research scholarship that was valued. And quite honestly, term faculty did not have very many. The opportunities, I guess, were there, but it really wasn't fully supported and embraced. So really, you advance now several years, and we've got a much more, I think, our culture of how our faculty view scholarship, it has really shifted. So it's not a either or, it's an and. So really, there's an embracing of of the big R traditional research. There is embracing on practice-based scholarship, and there's an embracement for educational scholarship. But I think the quality of the scholarly projects has also really been enhanced over the years. So again, I'm just so pleased, so proud. And this is just a small sample of the faculty that we have here. It's really very much heartfelt for me to be able to cheer on these efforts.
Jean, can I thank you for that so much for your comments on there, but I realize I'm talking about the first clinical scholars that I did, but I don't think I've had the opportunity to talk to the group, the alumni group who's been so involved with this. The clinical scholars project that I did earlier was a simulation project with Genevieve Beard. And she and I have spoken all over literally the world. We went to South Africa to talk about our outcomes. But I want you to know that the article that we wrote that described the project that we did with the funds from the clinical scholars won Best Article of the Year from the journal where we published. And then it's later on, it was listed as one of the few studies that were done that were published in this particular journal that really met all the criteria of high level research that was done. And again, that was a research study versus what we're doing, which is much more of a quality improvement related piece. But we are just your funds helped us to be able to do that, and that helps VCU. That helps put VCU's name on the map as well. And anyway, it's just really exciting to think about that trajectory of where we can take all of this. So thank you again.
Yeah, no, you bet. And yeah, I saw there were also a couple of comments anyway in the chat box saying thank you to all. So make sure our faculty check out the chat box. Kate Natsky, you've got your hand raised if you'd like to.
Natsky, you did it. Yes. Hard to pronounce. First of all, thank you. As a new faculty member, I look up to each of you and your abilities to really trailblaze and create these wonderful solutions, innovative solutions to some of the biggest problems I know that we're having. I am in acute care, and I see and recognize very similar issues as you recognized prior to initiating this project. As we look to mimic you, because this is becoming something in acute care that we're interested in doing, so that's amazing as far as dissemination. How do you create a well-rounded pod, if you will? How did you come up with the practice sites and create this well-rounded clinical experience for your students?
Excellent question. We actually start with the outcomes. The goal would be to provide a well-rounded clinical experience that meets the competencies by our certifying bodies. So NOF we have program outcomes, but the bodies that sort of certify us, that say you have to produce this, we look for that. So in FNPs, it's primary care experience across the lifespan. So we look at the role description and the competencies that each student needs to make, and then we put the pieces together so that students get a rotation and experience meeting each competency, and that can be measured by practice evaluations and our different program metrics. But what is it that we need to produce? And then you sort of create it backwards. So in ours, we had primary care, women's health, pediatrics, some mental health, cardiology, and orthopedics. Those are the big sort of buckets that we have to hit. So in acute care, we look at those competencies and then identify preceptors that can effectively teach that to our students.
Wonderful. Thank you very much.
All right. Any final, maybe time for one additional question? Just keeping tabs, seeing if anybody is unmuting themselves. All right, I don't see that to be the case. So to close things for our presentation today, again, would like to give a final thanks, especially to our core group of donors who helped to establish the Clinical Scholars Program Fund. And I mentioned that Judy Collins, her husband Joe, are on the call today. Other members of that group include Barbie Dunn, Mimi Bennett, and Joanne Henry. Joanne passed away sadly earlier this year. So just a final thanks to that core group. And of course, those of you who are on the call today who have supported that fund in the past and or continue to do so. We really appreciate it and hope that you found today's presentation to be informative and fruitful. And before we hang up, you will receive an email from my teammate Talise yet this afternoon. It'll be a short survey